Hello, Dr. Mike Matthews, physical therapist here with the PT 411. Thanks so much for joining me. If you already haven't done so, make sure you follow, like, subscribe on Facebook, YouTube, and Instagram so you can be notified when I come out with new content. This week, we're looking at cervicogenic headaches or migraines, meaning headaches or migraines that originate from the neck here. Now, the majority of what we have covered so far with the neck has been geared towards treating the lower cervical spine, the lower segments of the neck. And a lot of these issues can be traced back to poor postures that put us in this forward flex position here. Now, these headaches originate from the upper few segments of the spine and the base of the skull. And this problem often originates from the same issue, this forward protruded position right here. But there's one key difference on what's happening with the lower neck and the upper neck in this position that can make the treatment quite a bit different depending on if we're having these lower neck issues, pain that's more localized in our neck that goes down our upper trap, down into our shoulder blade, or down into our arm, and all different types of symptoms including numbness, tingling, pain, other weird sensations that are nerve related. Issues with our upper neck can have localized neck pains too, but if it's going to have radiating pain, it's going to happen along our jawline, other parts of our face. But more commonly, as it originates in that upper neck, it's going to radiate up over our head to our eyeball. And a lot of people can experience this radiating pain with its skipping spots, having that pain originating in the back of the head here that goes straight through to the eye, that feels like an ice pick that goes straight through your head right here. Treatments between the upper neck and the lower neck can be somewhat similar. Being stuck in one position, oftentimes all we need to do is mobilize in the opposite direction, get things opened up where they're closed off and vice versa. But sometimes the upper neck and lower neck can be treated a little differently since they're doing opposite things when we're stuck in this forward protruded position here. And when I mean opposite things here, to keep our head nice and level with the ground, when we're more upright here with that natural slight lordotic curve, that arch in that neck, whenever we're protruded more forward to stay nice and upright there. Now, instead of our entire neck being more extended, our lower neck ends up flexing quite a bit, but that upper neck has to arch quite a bit more there. If we were to flex our entire neck here, we would not be looking up, we would be looking down right there. So now that entire neck is flexed forward right there instead of extending that upper neck. So that lower neck here is in a state of that flexion where the front of that spine is getting closed off and the back of the spine is getting opened up. But up at the top, the opposite is happening where the front of the neck right here is getting opened up and the back of it is actually getting compressed or closed off. But since this retraction movement, right, coming back straight back this way, ends up reversing both that lower neck and that upper neck, oftentimes this is all we need to do to be able to fix this problem. The difference between the upper neck and the lower neck often responds quite a bit better to repeated movements, what we've been talking about in the past, but this upper neck often responds better to sustained holds. So retracting back and holding it for about 30 seconds or so at a time. Sometimes the pain can build up or get a little worse since we are opening up what's been closed off and vice versa. So sometimes as we hold this, it can get a little bit worse before it starts to release and get better. Also, probably when we're closing off what's been opened up, we're compressing against an obstruction or something that's a little bit out of place. It could be a disc or other soft tissues in that area, but sometimes as we close off the front of that neck that's been really opened up right there, it can start to produce some of those same issues there. But that sustained hold, just holding in that position for 30 seconds at a time, doing this several times a day, can oftentimes help out quite a bit with those headaches that are getting caused by that upper neck. But if the sustained hold coming back into that retraction is helping, but symptoms start to plateau off and we get limited benefit from this, we gotta add some overpressure. This is where that difference in positioning and that protruded position between the upper neck and the lower neck ends up making a big difference on how we treat it. So adding that overpressure in there, simply sometimes all we have to do is add a little pressure at that chin, making sure we're coming straight back here, but a big key here, since we're trying to get that upper neck that's been extended into more flexion, now we can actually start to tuck that chin more down here to accentuate that flexion here. So it's gonna look, instead of coming straight back like this for that overpressure for that lower neck, now we can add more of a chin tuck here, pushing down as we're going back. Now to get even more overpressure, we can take our other hand here at the base of our skull and actually lift straight up this way as we tuck that chin down and retract back. So it's gonna look like this, coming down here, lifting up here. And I'm not just lifting here, I'm lifting the skin and everything straight up right here. I'm lifting that scalp up to get as much overpressure here as I push down and back here. Same thing, we're doing sustained holds, about 30 seconds at a time, do multiple repetitions each time you do this, several times a day. An alternative to this overpressure is actually using both hands up here, and again, you're lifting your skin straight up and trying to get all that upper cervical flexion, that neck flexion right there, coming from your hands there, tucking that chin in and retracting back again. But as you do that, you can start to bring your lower neck into more flexion there and doing your sustained hold here. And oftentimes you can start to get some of these trigger points involved here that are right under that skin, since we're stretching the skin and everything directly under it quite a bit more here. So you can try this here, or we can even do it laying down. Now laying down, we can take advantage of the ground for some leverage to be able to get as much of that upper cervical flexion as we can. So we can take our hand behind our head right here and we can lift up that skin, get as much of that upper cervical flexion as possible, really lift up, place our head down here. We can add that overpressure with that chin, trying to go back and tuck in and just set it down right here and do our sustained hold here. Now the ground here is holding my head into as much flexion as I can, little overpressure at my chin. Same thing, prolonged hold, 30 seconds at a time, several times a day as we can do this. Now we can practice that alternative here as well. I'm gonna use one hand, but usually you'll use two. I'm only gonna use one so we can see on the camera. You're lifting up this way first, getting that upper cervical flexion. And as you do that, you let the lower neck flex as well and do that sustained hold there. But like I said, you do it with both hands, really lifting up that skin and getting that good prolonged hold, that good prolonged stretch there. But there's one other aspect to that upper neck that we need to make sure we address, especially if we're not getting any relief from this upper cervical flexion: rotation. The vast majority of our twisting and our neck comes from our upper few cervical vertebrae, where our headaches originate from. And sometimes going into these retractions here isn't quite enough on its own to address these headaches, and sometimes it is the wrong direction we need to go in. So anytime we're having these headaches, if we're not getting good relief from these retractions or this upper cervical neck flexion, we need to end up looking at that rotation there and see if we need to focus on that solely, or if we need to do a combination of rotating and retracting. So let's say we're having these headaches, we're pretty sure they're coming from the upper neck, we've gone through all this and it hasn't helped, or it's worsened things. We need to check out the rotation. So simply put, start off nice and comfortable. You're gonna rotate to each side as far as you can. You don't want to stop when it starts to be intolerable. Go until you just absolutely can't stand it, or we get to that restriction. So if we can go to each side and there's no problems there, no restrictions, it doesn't make our headaches any worse, there's probably not an issue with that rotation. But if we go into it, let's say we go to the left, it looks great, there's no issues. We go to the right, it gets stuck and or it's painful, we definitely need to start working in this direction here. It can be painful going through it since it's either obstructed or restricted. So we start off nice and slow, just trying that sustained hold, trying to go there just using our muscles. As we start to get used to this, we got to add some overpressure there. Just take your hand on that same side and you're going to put it along your jawline here. Or if you have TMJ issues, you can put it up higher here on your face. But you're gonna rotate to that side, adding that overpressure in there. Same thing, those sustained holds. Sometimes these rotations are enough to get rid of those headaches. Sometimes they aren't. Sometimes we have to add in that retraction as we work through this. So we start from a more comfortable position, and oftentimes it is that forward protruded position, but as we add that rotation in there, we get that rotation back here in this position, it might actually be restricted when we start to get a little more neutral position here. So we start off forward here, and then we start to retract back as that gets better. And then we might end up hitting that restriction in that more retracted position there. And so we've got to work it through that. And over time, we want to retract back further and further as we're stretching that out and mobilizing those upper cervical vertebrae and the base of that skull. And if you're getting decent relief, but it plateaus off with these rotations and you get full rotation as you're retracting back, then we go back to what we were talking about before, and we just start adding that overpressure just into that retraction there. And I cannot stress enough, no matter your age, activity level, whatever job you have, or athletics that you're into, we gotta make sure that we stay away from this protruded position for prolonged periods of time. We absolutely cannot do this. This is the most detrimental thing that we can do for our neck. So we really gotta watch that posture and try to prevent these issues from happening in the first place. And if we really fix this posture now and carry these good habits out through the rest of our life, we can invest in the future of our health. Again, if you already haven't done so, make sure you follow, like, and subscribe on Facebook, YouTube, and Instagram so you can be notified when I come out with new content. I'm Dr. Mike Matthews with the Physical Therapy 411. Thanks for joining me.